The Centers for Medicare and Medicaid Services now requires referring providers to consult appropriate use criteria, abbreviated AUC, via a clinical decision support mechanism prior to ordering CT, MRI, and nuclear medicine exams for patients that have Medicare as their primary insurance. ECMC utilizes the National Decision Support Company, abbreviated NDSC. This new program will affect Medicare patients that are seen in the emergency department, patients that have a same-day outpatient surgery, and patients that are in the observation status. The exception to this is for patients with emergent conditions. On the order screen, click on the drop-down to select the clinical indication. Once the clinical indication is selected, the National Decision Support Center will automatically launch in the web browser. In Meditech, the Imaging Appropriate Use Criteria window will remain on the Meditech order session. Relaunch will open the NDSC if accidentally closed. Refresh will refresh Meditech. Proceed without AUC allows the ordering process to continue in the case of a patient with an emergent condition or when you're having technical difficulties, and cancel will cancel the order. Based on the reason for exam that was selected in Meditech, the NDSC will display a list of closely related options. The provider will select the most appropriate clinical use indication. More than one can be selected. Based on the clinical indication, the NDSC will provide the appropriateness score of the selected order and other possibly clinically appropriate orders. Under the appropriateness rankings, the NDSC will provide some information about the selected order and the other possible clinically appropriate orders. It will provide the name of the order, the appropriateness score, the relative cost of the test, and the relative radiation level of the test. Based on these factors, the provider will make their selection on which test they would like to select. Once the provider has made their decision, the order will be processed through the NDSC and the information will be transmitted to Meditech. Click the X in the top right corner to exit the NDSC and return to Meditech. Back in Meditech, the clinical indication that was selected previously will remain, which may be different than the reason for the exam that was selected in the NDSC. Click the AUC button to view the imaging AUC screen, which contains the information transmitted from the NDSC. Click Cancel to return to the order screen where the ordering process can be completed. If the provider decides to confirm the selected order and the selected order has an AUC score of 4 to 9, the provider will click the green Confirm button to select the test and process the AUC information into Meditech. If the provider decides to confirm the selected order and the selected order has an AUC score of 1 to 3, the provider will click the green Confirm button to select the test, but will need to select a reason for confirming an order with a not appropriate AUC score. An acknowledgement reason window will open where the provider will need to select a reason for confirming an order with an inappropriate AUC score. Each reason has a free text box where the provider can provide further explanation if necessary. Once the acknowledgement reason is selected and any comments are entered, the provider will click Submit to process the AUC information into Meditech. If the provider decides to replace the selected order with a more appropriate order based on the AUC, the provider will click Replace next to the applicable test to select it. The NDSC will process the AUC information into Meditech. Back in Meditech, the new order will have replaced the initial order. In the case of providing emergent services to a trauma patient, the provider can place an order without an AUC check by clicking the Proceed Without AUC button to return to the order screen and proceed with the ordering process. If the provider decides to cancel the order, they have a few options once the NDSC launches. They can cancel an order from the Imaging Appropriate Use Criteria screen by clicking Cancel Order. The provider can also cancel an order from the Indication Selection screen by clicking the red Cancel button, or by clicking the red Cancel button on the selected order. A pop-up will display where the provider will confirm that they want to cancel the order. If the provider is ordering multiple imaging tests from an order set, an AUC check will need to be completed for each advanced diagnostic imaging that was ordered, and each order requires its own score. The orders that will need to have an AUC check will have an AUC button next to them. If any issues arise while performing an AUC check through the NDSC or completing orders in Meditech, please reach out to either the help desk at extension 4477 or the provider EMR hotline at extension 5601 option 1.